में अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Hello Apollo family. Did you know that India holds rank number 2 in the top 10 nations for people with diabetes? Well, I am sure that we would be the bottom of the list when it comes to awareness of diabetes. So join us today on Apollo 24/7's Health Hour, where we have invited Apollo's senior consultant endocrinologist Dr. Saptarshi Bhattacharya from Apollo's Indraprastha Hospitals, New Delhi. In this live session, let's clear confusions about diabetes, blood sugar cutoff levels, diet for diabetics, and lot more questions around diabetes. Join us and ask your questions in the live session. See you there, 11 a.m. today.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, welcome to Apollo 24/7's Health Hour. Every week we bring you an expert from Apollo Hospitals and talk about certain subjects where you can ask your questions and queries directly to the expert. Today we're going to talk about how to effectively manage diabetes, and joining us very shortly is Dr. Saptarshi Bhattacharya, Senior Consultant Endocrinologist from Apollo Hospitals, New Delhi. So join us in this, and then you can ask all the questions live in the YouTube only. I'm specifically mentioning to ask a query. Go ahead, YouTube में question पूछिए. I'm going to take up the question and pose it to doctor and get the answer for you. All right. On the show also you can win coupons and gift vouchers from Apollo 24/7. Also on the show we have a health quiz. You can win coupons and gifts if you answer 3 simple questions on the show. That is towards the end of the show. But today let me start the show by talking about a wonderful initiative called Saving the Child's Health Initiative, which is called SACHI in short, which is free pediatric consults for every child in need. SACHI, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 pediatric specialists from Apollo Hospital are benefiting children across India. So if you know a child who's in require of a specialty pediatrician, please do share this wonderful initiative with them. Scan the QR code to know more. All right, so let's start today's show. We're going to talk about the most dreaded diabetes and how we can effectively manage diabetes. Joining us now is Dr. Saptarshi Bhattacharya. It is an honor for me to introduce you all to Dr. Saptarshi Bhattacharya. He's a senior consultant endocrinologist, Indraprastha Apollo Hospitals, New Delhi. And Dr. Sab has been a great I'm sorry I'm not able to see the screen completely, but his experience is vast. He's the founder member of the Endocrine Society of Delhi, and he's published in international and national journals as well. So it's my honor and privilege introducing you, Dr. Saptarshi Bhattacharya. Namaskar, sir. Welcome to the show.
Thank you, Jesse. To
uh,
connect with
Technical
you too and
difficulties.
yeah, everybody who is active.
Yes.
Yeah.
So, hello, doctor. Once again, welcome. This is our Health Hour show where we have regular viewers. Viewers are waiting to listen from you and then ask their questions and queries as well. So, let me first ask you one simple question. What is that one level which can determine if I have sugar or not? It is varied across multiple platforms. So, what is the cutoff level? Let's start by that today.
I think it's a very important question, Jhansi. So maybe 1 2 years back, we have started with WhatsApp messages that somebody is claiming that blood sugar of 250 is okay. So that is so. If we need to understand that what are we trying to achieve by treating diabetes? So we are trying to achieve a long-term healthy life for everyone. So if blood sugar of 250 is not going to give you that. So
Right.
there are standard international cutoffs. So the fasting blood sugar 126 or more, according to American Diabetes Association, which is followed world over, or WHO. So that is labeled as diabetes. So if you have a 75-gram glucose and the 2-hour value post that is more than 200 is again diagnostic of diabetes. And if the HbA1c, which is the 3 months average blood sugar report, so that's give you an assessment how things have been going on for the last 3 months. So if that is more than 6.5, that is also suggestive of diabetes. So
Okay.
fasting more than 126, 2-hour post glucose more than 200, and HbA1c more than 6.5. So this is diagnostic of diabetes. But if somebody gets diagnosed with diabetes, then the target is usually in the range hovering around that. So you can't have a blood sugar of 250. Maybe you will be today, you will be fine, but after 5 years, you might have a lot of complications.
Right. So it is not about how much of sugar you have right now, but managing or living with diabetes that is going to cause a concern for a long term. अगर मैं
Definitely.
सोचती हूँ कि डायबिटीज है, it's not like आज आ गया और कल या परसों खत्म हो जाएगा, 2 3 महीने का ट्रीटमेंट हो गया और this is done.
नहीं, नहीं,
This is going to be
बिल्कुल नहीं है।
right.
So बिल्कुल नहीं है। So what we need to understand, we are not treating a value or no, we are not treating a number. We are treating your health. So
Correct.
if your health is important to us, and if you are, and there are some parameters which help us achieving an optimum health for you on the long run. सो किसी कोई अगर कहे नहीं नहीं मैं तो बिल्कुल ठीक हूँ, मेरा शुगर 250 है, 300 है, 350 है, बट आई एम फाइन. It's good that you are fine today, so we are very happy about it, but we want you to be happy after 10 years or 5 years or 15 years. So that is our we are not looking at short term goals, we are looking at long term goals.
So let me understand what will happen if I let my diabetes go untreated or unmonitored. Long term में क्या हो
Yeah,
सकता है?
I'm very happy that you raised up this question because uh, so many of my patients come to my OPD and they tell that I am totally okay. My sugar is 200, 250, 300. I am fine. So why do I need to treat it? So again, we were discussing that right now. So diabetes is a disease which will slowly and gradually can affect multiple organs. So
जी.
the most common cause of cause of mortality and morbidity in diabetes is cardiac disease, and it can, you all know, it can affect the kidney, it can affect the liver, it can affect the nerves. So there are multiple organs which can get affected, and the problem is that once you get affected and you reach a doctor and you want a ready solution, नहीं नहीं मेरे को ये प्रॉब्लम है, मेरे को आप मेरे को इसका सॉल्यूशन दो, तो वो नहीं हो पाता. So your diabetes has been there for last 5 years or 10 years. You have not addressed it. So that has gradually, most of the manifestations of diabetes will manifest after 5 to 10 years of uncontrolled diabetes. So there are some situations, obviously, you have acute diabetes related complications, that is a separate issue. But most of the complications will manifest after 5 to 10 years or 15 years of uncontrolled diabetes. Then you want a ready solution, you go to your doctor. It's not possible because this has accrued over a slowly accrued and
Right.
damaged your systems over so many years. So you what you need to do is prevent all the complications right from the beginning by controlling your diabetes.
Right. So, understanding that you got to take care and management is important. One simple question that keeps surfacing is, can diabetes be reversed? Can this be cured totally?
So, in fact, in my Facebook page, I at least get at least 3 to 4 promotions related to diabetes can be reversed. My HbA1c was 9.1, and today my HbA1c today is 5.9. So, first of all, you need to understand that diabetes is a progressive disease. So if you are getting diagnosed with diabetes today, so already 60% or 80% of your insulin reserve in the pancreas is gone. And it's a the natural history of diabetes is that it's going to gradually progress. So if you want to reverse diabetes, the simple solution is to lose weight. If somebody is overweight or obese and you lose
Lose.
5 to 10%, because somebody is weighing 80 kg and come back to 70 kg, so maybe there's a very strong chance that the medication requirement or temporarily the medications can be stopped. But on a long term basis, so if somebody feels that okay, my HbA1c was earlier 8.9 and now it's 5.7, so I can start eating sweets. So again you will end up with the doctor after 10 days or 15 days or 2 months with a blood sugar of 200 to 50. So diabetes by losing weight can be reversed. So obviously bariatric surgery is one such procedure. If you change your lifestyle in a very strong way, following a very strict diet and exercise and doing everything whatever the doctor is telling you can do it. So but that doesn't mean that you can start eating everything. So it can be reversed. The chances are usually less, 2, 3, 5 out of 100. But again, 90-95% majority will require medicines, will and need to control their diet and lifestyle as well. But for majority, 2, 3, 5, you can have a reversal, but that doesn't mean you start eating sweets. So there is no magic where you can say, "Can any my diabetes is reversed? I will have a party and have 4 rasgullas on tomorrow. So that's not going to happen.
Right. So understanding that diabetes is not just one day, 1 week, 1 month, 1 year management, it is a lifelong management. It's just that you're off medication or on medication and how much medication. That is just the
Yeah,
parameter.
yeah,
Right, doctor?
right.
So
So
it
so
will not
it's
be
it's like it's like, so even if your diabetes is reversed, that only means that you are off medicine. So, but that
right.
doesn't mean you start eating sweets or you change your lifestyle, you get back to a normal way of life. So, whenever you do it, most probably after 3 months, you will be meeting me again with a blood sugar of 200.
Okay. So one person that I don't want to meet is you, doctor. Then one
Definitely.
person in your,
I also, well, I can meet you any other time, but
but not in
not
your
in my,
consultation.
not in my chamber.
Yes, doctor. I will take that as a very very बहुत ठान के लिए रखी हूँ कि मुझे डायबिटीज नहीं होना चाहिए. Alright. Second
Definitely.
thing.
And you can do it by changing your lifestyle. So there is that's a very valid question. So we get questions from, so somebody is taking their father and mother to my clinic and they are asking, so how can I not develop diabetes? So since both my parents are diabetes, he has a, so like the prevalence of diabetes, if you look into India or maybe all across the world, it's 1 in 10. So if there are 10 adult persons, one out of them will be having diabetes. So maybe if you are looking at metropolitan cities like Delhi or Hyderabad or Chennai, so you will be looking at maybe 14% diabetes prevalence. So that will maybe out of 100 people, 14 or 15 will be diabetic. So, and if you have a parent who is already diabetic, it will be like 1 in 5. So you have a tendency to develop diabetes. Like 5 out of 1 will have diabetes, and if both your parents are diabetic, it will be 2 out of 5. So you have a 40% chance of developing diabetes. And if you want to avoid that, so the thing you need to do, so whatever diet I have suggested for your dad and mom, so you need to follow that in your lifestyle.
Okay, okay, great. So, what about the next generation? What about the if I'm granddaughter of diabetic grandparent? So, am I at risk, and what's that kind of risk?
Yes.
My
Yeah,
parents were not diabetic.
I think your parents might not be having the manifestations of diabetes right now. So diabetes is a what? So there are some genes which are like genetic, totally one-to-one transmission. So diabetes is like a polygenetic disease. There are multiple genes which are actually working together to have an outcome on you. And so if your grandparent is diabetic, your grandmother is diabetic, your grandfather is diabetic, so even though you don't have diabetes right now, your parents are not diabetic right now, but you are carrying partly some of the genes. So
Correct.
obviously the chance of developing diabetes is higher. So my suggestion is just maintain simple healthy lifestyle, which will benefit not only you, maybe the rest of your family. So for my son who is only 6.5 years, and I keep on telling him don't eat so much of butter. So he butter is his favorite. So I try to insist,
So
okay, you can
everybody
have,
has to be cautious. Need to
yeah,
be
yeah.
cautious.
Let's
Lifestyle, food
go to a
choices.
healthy lifestyle. So Indians have a genetic predisposition as a racial tendency. So whatever be the reason, they are predisposed to diabetes and complications related to it. So if we try to inculcate changes right from the beginning, so right from childhood. So once you have diabetes, at somebody comes to me with a blood sugar value of 250 or 300, so ho gaya. So we can't do much about it. So the bottom line remains, we need to work much earlier. So right from childhood, that you need to stop potato chips, you need to stop junk, you need to stop so much of burgers and pizzas and all those things right from the beginning.
Doctor, one interesting observation that I've always made, because we have a lot of family members with diabetes and we've seen them manage. So one of my aunt always used to say, "मैं sugar नहीं खाऊंगी, मैं मीठा नहीं खाऊंगी, but I will eat everything else. So that should be taking care of my diabetes." So for them,
No, no, no.
sugar is directly related to sugar. She always used to equate, मैं sweet नहीं खाऊंगी पर मैं चावल खाऊंगी, मैं कुछ और खाऊंगी, तला हुआ चीज खाऊंगी. Everything that she used to go wrong. हम लोग कितना भी बोले, she used to think sugar is the only thing that she needs to avoid.
See, what we need to understand is that sugar is like a simple carbohydrate. So if you eat sugar, so it's going to go into the gut, getting absorbed immediately, and going to rise your blood sugar like this. So
Right.
the purpose of treating diabetes is to stop this diabetic glycemic fluctuation. So if you're not eating sugar, but if you are eating maida, if you're eating a pakoda, you are eating if you are eating a rice-based idli or rice-based dosa, so that is going to have an impact on your immediate blood sugar levels. So your sugars will go up. So if you have internal insulin secretion, so that will try to curb it down. If you don't have it, it will remain high. So and then the high sugar will have slowly it will start, not today, maybe 5 years, 10 years, 15 years, 20 years down the line. So it will have an impact on most of your organs. So sugar, it's not only about sugar or नहीं मैंने चीनी मैंने शुगर नहीं ले लिया, ये गुड़ नहीं ले लिया, but again it's going to affect the organs very slowly, and the problem is that once it starts getting affected, we can't do much about it.
Correct. So let me start with the questions from audience. I see various questions and range of questions being asked by audience. Thank you, audience, for asking these questions, which are very important. So first, let me start with Harshavardhan Negi's question. Harshavardhan is asking, so if I need to be sure that I need to manage diabetes, what is the kind of diet I need to take? Any diet
So I think
recommendation?
it's a complicated issue. So first of all, my suggestion will be to get in touch with a dietitian properly. But if you want a simple solution, so you should be avoiding refined sugars, the refined carbohydrates. So like sugar, jaggery, honey, maida. So these are the things you need to avoid. You can you also need to avoid fats which are solid or semi-solid in room temperature. So ghee,
Okay.
butter, coconut oil, that should be avoided, because most of the diabetes complications occurs from heart disease, and these are the oils which have more of saturated fat, and they tend to clog the arteries, which cause which maintains the blood flow in your heart. And obviously you need to have a healthy lifestyle. So simple solution: less refined carbohydrate, no fats which are solid or semi-solid and room temperature, and the healthy lifestyle and timely eating. So if you are a diabetic and if you are eating in the morning and again eating at night, that is also not going to work. So all these three four components need to be integrated in your daily lifestyle.
Yeah, I'm हर्षवर्धन नेगी जी. I'm sorry, I by mistake मैंने आपका नाम किसी और के question पे ले लिया है. But Sean David and Bengal Tiger were asking the diet question. Sorry for that. Harshavardhan's question was, is insulin good or bad, and what are the types of diabetes?
So again a very important question. Types of diabetes, it's type 1, which means that there is an internal intrinsic deficiency of insulin in the system. Usually occurs in children. It's an immune mediated process, and as of now, sadly, we don't have a treatment other than giving insulin injection or insulin through the pump. So, so type 1 diabetes, we keep on seeing some videos where somebody is claiming that you take this, your type 1 diabetes is going to cure. Very sorry. So we had at least 8 to 10 patients who landed up in the emergency after following such videos, and
Oh,
you should not be doing it. So young children, type 1 diabetes, you need to take insulin. Sadly, we don't have any other option right now. Science is evolving. Maybe after 10 years, 15 years, 20 years, we might have a solution. But type 1 diabetes means you do not have insulin from secretion from the pancreas. It's an internal process which has damaged your insulin secretion. You can't do anything about it. Type 2 diabetes, that is the majority of or bulk of the diabetes we keep on seeing every day in everyday life, and that can be treated with medicines, or if after 15-20 years that also tends to progress towards insulin deficiency. I already told that 70 to 80% of the insulin secretion is already gone when somebody is getting diagnosed with diabetes. So that needs to be, so maybe if somebody is following a proper diet, lifestyle, and medicines, that can be controlled for long years without any other intervention and avoiding complication. There are some rare varieties of diabetes, like uh, uh, if somebody had a pancreatic surgery or some pancreatic disease, so might develop insulin deficiency after that. And there is another diabetes which is very very important and we very see very commonly. Maybe one out of 10 or 1 out of 5 is gestational diabetes mellitus. So I again I want to tell all my whoever is watching this program and also spread this message and awareness that this is like a treadmill test. So if you, whether you have a cardiac problem or not, you go to a doctor, cardiologist, he writes you a treadmill test. Okay, you run and see, we'll see whether you have ECG changes or echo changes or not. So this is like a treadmill test for diabetes. So if you are having gestational diabetes, so that means you have your pregnancy related hormonal changes have caused some changes in your system where the sugars are going up. And even though after delivery it's going to get cured, but if you're not going to address it after 5 years or 10 years, you have a very very strong chance of developing diabetes. So all gestational diabetes ladies, please be careful that you need to address that aspect. So
So
you need to
it is
continue, not
not, yes,
not you
not
need to continue on diet and lifestyle changes. So and that will go a long way in avoiding it.
right.
Yeah,
So a
yeah.
lot of
Yes, yes.
people are asking, they are typing कि हमारा HbA1c is so much, and how do I reduce it, or am I diabetic? A lot of people are asking. For example, Shubham Srivastava says my mother's HbA1c is 13.9. I want to reduce it. Uh, can we do it by not opting for insulin? She's very weak. And Narendra Singh is, I'm a 46-year-old, HbA1c is 9.3. Only HbA1c, is it going to give us some data?
Yeah, so it's like the H1C is a representation of the last 3 months average blood sugar report.
Right.
So which one is 13.6. So we need to go into multiple things. Diabetes is not like a simple solution. Okay, you do this and it's going to work like a magic. So first of all, the person who is having diabetes needs to get involved in the process. So you go to a doctor with an infection, even with COVID. Now COVID, thankfully, it has become so simple. So whatever numbers we are having, so thankfully it's not a very complicated situation. So you take a medicine, you get okay with it, and it's over. Diabetes is not that. So diabetes is something where you need to get involved in each and every step. You come to an OPD, meet the doctor, meet the endocrinologist, and you feel okay. It's done. So I doctor has written this medicine. I can do whatever you want. That is not going to work. So diabetes is a lifestyle disease where each and every step of yours, each and every diet of yours is going to make a difference. So if you are medicine is just a small and simple part. But if you are not following your lifestyle, so if you are eating sugars and your age months is certain, so it can't be solved. The first step is diet and lifestyle changes. Then we need to address the medicines. And if medicines don't work in some, somebody might even require insulin. So this is like a step by step process, but the person has to be a part of the management strategy. So if you are only looking at medicines and numbers, it's not going to work. So unless, so I keep on telling all everybody who comes to my OPD, so if you don't want to control it, I can't do it. If you want to control it, I can help you. If you don't want to do it, and if you are okay, your son has pestered you to come to my OPD, and you want to go back and eat everything, I can't do anything about it. So you need to understand yourself that you have to control it.
Okay, done. So here's an interesting question. Mamidi Ramakrishna Rao ji is asking, how frequently should we consult a doctor? I am diabetic and I'm glycemia VM1 twice a day. The same was suggested to me more than 1 year ago.
See, there are two, three aspects about consulting a doctor. So obviously, maybe if you're consulting the right doctor, that will keep you motivated about managing diabetes. And if you are achieving your goals, so there are some tests which are recommended periodically, like fasting blood sugar and HbA1c and maybe a postprandial sugars. And if some of the parameters are deranged, those parameters, so you need to get it done on a maybe a periodic basis. So there are some tests which needs to be done annually. So there
Okay.
is no confusion about that. So if you are thinking नहीं मेरा तो किडनी ठीक है, and when you see creatinine is 1.9 or 2.2, and you tell your doctor नहीं नहीं डॉक्टर साहब इसको तो ठीक तो कर दो, so it's not going to work. So this creatinine 1.9 or 2.2 or 2.5, that has occurred over a period of 2, 3, 4, 5 years of uncontrolled diabetes. So first of all, so there are some recommendations from all societies, be it American Diabetes Association, be it WHO, be it the Indian Diabetic Societies. So maybe you need to get your kidney test annually. Need to get a test which is very often missed is the urine microalbumin creatinine ratio. So that is a test which is very important, because if you're looking at creatinine and if it starts getting high, so it's already late. So the first change which occurs related to kidney, and everybody is apprehensive about नहीं नहीं diabetes में तो kidney खराब हो जाएगा and some of the medicines will damage my kidney. So that's not the case. So medicines, most 90 there is not even a single medicine in diabetes including metformin. So I want to put it on record. So that damages the kidney. So it's only the blood sugar which damages the kidney. So if your creatinine is high, so it's already too late. So the first thing which the change which occurs is the urine microalbumin creatinine ratio. So if that starts going high, so that means there is some damage in the kidney, and you need to check your retina. The very common cause of diabetes related problem is chronic liver disease. So you need to check your liver function test, and if that is deranged, you need to get more tests. So and lipid profile. For some, even if somebody is at a very high risk of cardiac disease, we suggest cardiac disease every 3 4 years or so. So these are the tests which should be done routinely. We should not be waiting. अच्छा मेरे को ये प्रॉब्लम आ गया, मैं डॉक्टर के पास जाता हूँ, टेस्ट कर लिया, इसमें खराबी आ गया, डॉक्टर ने दवा लिख दिया और ठीक हो जाएगा, नहीं हो पाएगा. So this has happened over so many years. So if you want to get it sorted, so you need to prevent it. So most of the diabetes complications can only be prevented, and we have treatments, but the treatment options are actually get limited when you have a definitive complication.
Done. Here's the next question. Samir Bhargava is saying, my fasting sugar is coming around 110 for the last 1 month. Other readings are all in parameters. So kindly advise if any action is required.
So again, it's a very important question. So fasting less than 100 is considered as normal. 100 to 126 is considered as pre-diabetes. More than 126 is considered as diabetes. HbA1c less than 5.7 is normal. 5.7 to 6.4 is pre-diabetes. More than 6.5 or more is considered as diabetes. So if your sugars are in the pre-diabetes range, maybe you need to monitor it periodically once every 2 to 3 years, and you need to change your lifestyle. So obviously if you have pre-diabetes, you don't have diabetes, you don't require medicine, But if you start changing your lifestyle right from now, the chance of developing diabetes later will go down. So otherwise, whoever is having pre-diabetes, they have a very strong chance of developing diabetes over the next few years. So
Okay.
if you want to avoid that, you just need to avoid sugars. You need to change your lifestyle, start exercising, start avoiding refined carbohydrate, stop eating excess fat. So these are the changes you need to institute.
Right. So here's a question Nagendra Singh is asking. Sugar levels have been 326 and 465, and this has happened in last 6 to 7 months as I got my medicals done in October last year. Uh, it was okay. इनका question complete नहीं हुआ है, but alarming numbers of sugars है ना?
Even if you, Mr. Nagendra, even if you have not completed the question, so sugars 326 and 400, you might be feeling fine today, but you need to urgently consult a doctor. So
Right.
need to get fresh blood reports. Please get a consult a doctor right now, and so you need to get it down. So this, maybe you are feeling fine today, but after 5 years there will be a strong chance for complications. So you just need to sort it out. So
Okay.
we cannot have a blood sugar in this range and just let it be.
Totally. Totally. Yes. Here's next question, Debasis Mandal. How do you manage muscle pain and fatigue? My sugar level is well controlled, still feeling fatigue with muscle pain, especially in at bedtime.
See, there is one complication of diabetes, which is diabetic neuropathy. So there will be some irritation to nerves, even with very well controlled blood sugars. So you need to take care of that. And a very common cause of muscle pain and nerve pain in diabetes is vitamin D deficiency. So it's very very prevalent. So so if you take a survey of like 100 people, and if somebody is not taking vitamin D, so 80 to 90 of them will be having vitamin D deficiency. So you need to supplement that. So you don't need to get a test for it. So it's like 1,000 or 1,500 rupees test. You need to get a test for that. Just take maybe a weekly or a fortnightly or a monthly vitamin D 60K tablets, anything which suits you, and that will help. Another problem is that you there is a very common prevalence of vitamin B12 deficiency. So the source of vitamin B12 is animal fats, animal food. So if somebody is a non-vegetarian, might the vitamin B12 levels might be okay, but if somebody is a vegetarian, the vitamin B12 usually tends to be low. So you need to start taking a vitamin B12. And if you are taking these two the basic things which I can advise on this platform. Otherwise, if the pain still persists, you need to consult your doctor and see that whether there is any other reason or not.
Done. Here's the next question, which is pre-gab okay for foot and nerve pain within diabetes? Any side effects? This is asked by Satish Batra.
Again, a very important question. So what you need to, your foot and nerve pain in diabetes is related to diabetic neuropathy. So
Right.
this has occurred most probably you are having diabetes for last 5, 10, or 15 years, and it's a slowly occurring complication. And pregabalin is something what pregab contains. It only will soothe your nerves. So this is not a medication which is like a painkiller. So you if you take it on a long term basis, if you are taking an NSAID like say brufen, ibuprofen, or a indomethacin, so that might affect your kidney. So it's not something like that. So it's a painkiller which is only going to affect your nerves. It's not a proper painkiller also. So it's a nerve soothing agent. So it's not going to change your course of diabetes related neuropathy, but it's going to give you some relief related to symptoms. So if your symptoms are that much that you require it, then obviously you need to take it if your doctor has suggested it. But if your symptoms are very mild and if you're comfortable even without taking it, this is not something which is essential and is going to change the course of neuropathy in diabetes. So this is only a symptomatic treatment. It's up to you and your doctor whether you need to take it or not.
Done. So here's a related question. Manikanta Yadav is asking: Once get if I'm affected with DM, that is diabetes, what are the future complications? Can all diabetes lead to retinopathy, neuropathy, or nephropathy?
The most of the so I started with that in the beginning. So purpose, we are not treating numbers. When you are treating your health. So the purpose of treating diabetes is to keep you healthy for the next 30, 40, 50, 60 years.
Well said.
So if you are able to control your diabetes, and if your sugar levels are normal, if your BP is normal, if your cholesterol levels are normal, so most of the complications of diabetes, including retinopathy, neuropathy, cardiovascular disease, then so
Nephropathy.
kidney
Yeah.
disease, liver diseases, so everything can be controlled. So it depends on you how you want to keep it. But if somebody develops a complication and you want a ready solution for it, we don't have it because this has happened over years. So the purpose of treating diabetes is to keep you healthy for on a long-term basis. It's not about numbers.
Okay. Sean David is asking: Does diabetes cause muscle loss? And if so, how can I regain muscle?
Diabetes, if it's uncontrolled, so it's a catabolic state, so where your muscle can get wasted. And but if you are like taking the right diet, doing the right exercise, so you should be able to gain back that muscle. So first of all, your sugars need to be controlled, and after that, there are some medication which can cause weight loss. So that doesn't mean that it's causing muscle loss. So there are some medications like metformin or SGLT2 inhibitors or GLP-1 analogs that is actually considered a benefit for diabetes. So in that case, so we do not, we are happy if somebody is losing weight. But if you feel that if you're specifically losing your muscle mass, then maybe you need to increase your protein intake. So Indian diet, sometimes we have a थोड़ा सा creatinine बढ़ गया, डॉक्टर ने सब प्रोटीन बंद कर दिया, वो
Bankar.
नहीं करना. So what you need to do is, so you need to have a balanced protein intake and balanced lifestyle and diet and exercise. So it should help you to regain your muscles.
Thank you, doctor. Satyabrata Behra is asking this question: Can pancreas cell be regenerated by stem cell therapy?
So again, it's a very pertinent question, and we keep on getting these queries in our consultations and clinics from all across India. And so as of now, the answer is it's in an investigational stage. So if you want to be part of a research project which is trying this, you can do it. So as of now, if you are paying say lakhs of rupees to get a stem cell therapy done for diabetes, so most probably it should not be done. So India government strategies as of now, they do not approve, or even most of the US societies or European societies, they do not approve stem cell therapy as a cure for diabetes. So if you want to get involved as a part of a research project in with somebody where they are offering you this as a part of a research thing, okay, we are trying to do it, telling you all the pros and cons, you can do it. But if you are made to pay 5 lakhs or 10 lakhs or 15 lakh of rupees for this, and somebody is claiming that your diabetes is going to be cured, so most probably that person is going to get a Nobel Prize in after 2 years. So that science has not reached that level. I wish it had, but it as of now we don't have that answer. So don't fall into praise of insulin stem cell therapy, pancreas transplant, EAO. Pancreas transplant is done in some cases of where kidney failure and pancreas failure in type 1 diabetes, we do it. But again, as a routine therapy for diabetes, we do not recommend it. It's a very strong message. So don't fall prey to such messages that somebody can reverse your diabetes, somebody can infuse stem cells and your diabetes will be okay. We'll be doing it, and after 5 years or 2 years, or not even maybe after a year, you'll fall back to the same place.
Right. Kathiravan Venkatachalam ji is asking, can you throw some light on intermittent fasting and diabetes? You suggested, doctor.
I think these are matlab, maybe around 3 years back. If we are doing this show, so we would have got a query on keto diet. So now intermittent fasting is very popular. So again, this is something which is okay. So these are changes which does make a difference. But the problem with all this diets are their sustainability. So whether you will be able to do intermittent fasting for a very long term. So if you are able to do it, and till the time you do it, it's going to make a difference to your glycemic control. It's going to, maybe your medication requirements are going to go down. But if you're on medications like insulin or a tablet which like glimepiride or glycoside, which have a tendency to cause low sugar, so intermittent fasting of 16 hours or so. So minimum duration has to be close to 14 to 16 hours. So in that case, so it's not going to, so you will end up with hypoglycemia, provided you are not on medications for diabetes which have a tendency to cause hypoglycemia. You can do intermittent fasting. It does work, but how long you will be able to sustain it, it's a matter, matlab, it depends on you. And please get in touch with a dietitian or a nutritionist or a doctor who can guide you through it. Don't go through some fancy literature and start intermittent fasting. So do get in touch with the person who is actually qualified to suggest it to you, and do it. If you till the time you are doing it and your sugars are okay and you don't have a problem, I think it's not a major problem.
Done. Rajendra Prasad ji पूछते हैं, should we check and monitor HbA1c or glucose fasting random or any other parameters to keep a watch on sugar levels, and how frequently we should check it for diabetics and non-diabetics?
So first of all, let's go to the non-diabetic. So if somebody is non-diabetic, so it's the recommendation is like 1, 2, or 3 years. So usually the American Diabetes Association recommends like every 3 year you need to get your HbA1c done or fasting blood glucose done. That is okay. So you don't need to check it annually. So if you are doing it, it's good. If you are not checking it, it's even then also it's okay. Once you have diabetes, so then it depends on your blood sugar parameters. So if your blood sugars are well controlled, so if you are checking every 3 months, 4 months, 5 months, or 6 months, that is okay. So if your sugars are not well controlled, so if your H1C is 9, 10, so you need to take steps to control it, and you need to understand whether those steps are working. So till your sugars are getting well controlled, so you need to check it more frequently. So if somebody is on insulin, so we suggest them to get checks done every day, maybe on a daily basis, 2 3 times. If somebody is not on insulin, taking medications, maybe we will suggest that you get your checks done. Maybe you don't need to give a blood sample to a lab every day, but every 4, 5, 6, 7 days, you need to get your sugars checked and understand whether the medication which has been given is working or not. So it depends on your glycemic status. If it's well controlled, it's up to you. It's good to have at least a 3 to 6 monthly checkup with a diabetes doctor. If you are otherwise fine, totally well controlled, even if you are going for an annual checkup, that is okay. But if you are uncontrolled, प्लीज डोंट गो इनटू दैट फ्रेम, नहीं नहीं मैं तो मैनेज कर लूंगा, मेरे को कंप्लेन, मेरे को तो कोई प्रॉब्लम है ही नहीं, मेरा शुगर 250 है तो मैं तो रोज 2 घंटे के लिए सैर पे जाता हूँ, मेरे को क्या दिक्कत है. So we get patients like that. So obviously So if that person comes to me or an endocrinologist after say 2 months or 3 months or 2 years or 3 years with a problem and they want an immediate answer, मेरा तो डॉक्टर साहब बिल्कुल ठीक चल रहा था, कोई दिक्कत था ही नहीं, 200-300 शुगर था, तो मैं तो सैड के लिए जा रहा था रोज, लेकिन मेरे को कोई दिक्कत तो था ही नहीं. But then if you expect some magic from us, that's not going to occur. So it can only be prevented.
Done. Vinay Gupta ji पूछते हैं, if my HbA1c is reduced from 7.2 to 6 by modifying lifestyle and diet, can I stop taking medicine or should I continue taking medicine?
See, first of all, 7.2, more than 6.5, we already discussed, Jhansi, that it's diabetes. So, and if somebody is on medication and the HbA1c was 7.2 to start with and has come down to 6, that means the medicines are working. So, whether you can be taken off medicine or not, that depends on your doctor. So you need to discuss it with your doctor. So it depends on the amount of medicine you are taking. So your target HbA1c is like 6 to 6.5. So if you are very well controlled, if you have diabetes, if your HbA1c is 6, that means the medicines are working. That doesn't mean that the medicines have cured your diabetes. So if your HbA1c is 6 and you are maybe the minimum dose of medication possible, so that depends on you and your doctor and how much lifestyle changes you are trying to inculcate in your daily routine, whether you need to take it or not. But if you are on a reasonable number of medicines and your HbA1c is 6, and if you think नहीं मेरा तो 6 हो गया, मेरा सारे दवा बंद हो जाएगा and I can start eating sweets, that's not going to work. So obviously you need to discuss it with your doctor. So it's good your HbA1c has come down to 6. Whether you need to take medicine or not, it depends on your doctor. But if the target is 6 to 6, well, 6.5 or less, so if you're reaching 6, that means your medications are working. At least you need to continue on the same medicines. If the medications can be reduced or not, it depends on your doctor.
Yeah. Doctor, a little while ago you were talking about gestational diabetes. Here's a question Abhishek Gupta ji पूछते हैं. My wife is expecting and suffering from gestational diabetes. During the first pregnancy as well, she had the GD, but it gets normal after delivery. But this time doctor has advised insulin. My concern is, do we need to continue insulin even after delivery as well?
See, I am very happy that somebody asked this question. There is a very common myth that if you start insulin, you need to continue it forever. So that is not the case. There are so many situations like gestational diabetes, or if somebody is undergoing maybe a surgery and the sugars are uncontrolled, or somebody is having some infection or some other complication, we even give insulin for a very short duration, and once the complication is over, you stop insulin. So insulin, very clear message that insulin does not make you dependent. So it's a very common misconception that okay, एक बार इंसुलिन ले लिया तो चलता ही रहेगा. ऐसा कुछ नहीं है. बहुत commonly, most of our patients who are getting admitted in Apollo, so they all require insulin during around their surgery or their whatever interventions that they are going through, and we stop insulin and discharge them on medications, whatever medications they were taking before admission. So if they are oil control, we put them on that and send them back. So insulin does not make you dependent on insulin. Or
Right.
gestational diabetes, if I am coming to your question, Jasi, so it's like it's a slightly the cutoffs are different. So the normally the baby draws sugar from the mother, and the sugar levels are much lower than what is expected in a normal situation. So normally your sugars will be like 90, 100, 110. For a pregnant mother, normal sugars are in the range of 80s fasting. So if a doctor has advised insulin, so you need to take insulin, and the target is less than what is normally considered. The target fasting blood sugar is like less than 95. The target 2 hour blood sugar is less than 120. The target 1 hour blood sugar is less than 140. So if you are reaching that level with lifestyle changes, that is okay. You need to monitor. If your sugars are not getting controlled, you definitely need to start insulin. Get in touch with the gynecologist or endocrinologist or the physician, whoever is treating you. And if you're and this is going to stop. This is because of this is a treatment for the baby. This is not. We do not treat 140 or 150 blood sugars with insulin in a normal in a non-pregnant situation. So definitely the day in the lady delivers, the insulin medication is going to stop. So you don't need to continue with insulin or any other medication after delivery. Obviously, you need to monitor whether it remains controlled or not. But specifically to a question, insulin, if the sugars are high, is required right now during gestational diabetes. After delivery, it can be stopped, but she needs to be careful about development risk of development of diabetes in future. We started that like GDM is like a TMT for diabetes. So if somebody has GDM, we need to be careful about it.
Done, sir. So one quick question, uric acid के बारे में Karthik is asking, will diabetic medicines I'm sorry, I could.
Sulfonylurea, sulfonylurea,
Yes.
yeah.
Will that increase uric acid? My uric acid levels are about 8.8.0 and not reducing. Uric acid levels were normal before diagnosis of diabetes.
So I think there are a few situations which you need to look into. So there is a lot of myth about uric acid. I'm really grateful to Karthik that he asked this question. And so uric acid, if it's high and if it's causing gout, so that is a strong indication for treatment. So we started with the same concept that we don't need to treat numbers. We need to treat disease. We need to treat your health. We need to make you safe and healthy on a long term basis. So for uric acid also the same remains valid. So if even if your uric acid is like 8.5, you need to discuss it with your doctor that whether you actually need to get treatment for uric acid or not. So dietary changes, red meat and seafood, and fructose and glucose, these are the only things that actually affect uric acid. There are some blood pressure medications like thiazide diuretics, which also affect uric acid. So if you are already on that, you can discuss it with your doctor and get it changed. So otherwise, in most of the situation, it's not the number you are treating. We are treating your health. So if you don't have a gouty arthritis or a major problem related to your great toe, usually the first manifestation is
Is
the
on the big toe.
like great toe. So you don't need to do anything about it.
All right. So, last one question that I would want to. Manikanta Yadav has been asking this question. A family friend is suffering from diabetes from 3 years. Additionally, he's also a psychiatric patient. Currently, he is not accepting medications. How to cope this situation up?
I think it's a challenging situation. So obviously, so diabetes, the first treatment which we again and again I will like to reinforce and recommend is lifestyle change. So if you don't yourself want to control diabetes, so the doctor can't help. So, and but if you have a situation like a psychiatric problem where the person is not accepting medications, obviously, so there are you need to discuss it with your psychiatrist whether those medications need to be changed so that he or she becomes more compliant with the medication intake. And also at the same time, if if somebody is totally resistant to taking medication, so there are ways to give it. So even
Correct.
psychiatric medication, if somebody is strongly resistant to it, we mix it with food or water and then give it. So again, you need to discuss it with your doctor and
Right.
find out the right way through it.
Yes, one last question. I know that I keep saying this, and but I take last question. Harpreet Singh ji, last minute में पूछ रहे हैं, how do I treat frequent urinary tract infections or fungal infections in diabetes?
See, there are that is usually a complication of uncontrolled diabetes. So first of all, if your diabetes is uncontrolled, you need to treat that. There are some medications which have a side effect related to urinary infection or genital infection. So if you are on a SGLT2 inhibitor like a dapagliflozin or empagliflozin or canagliflozin or remogliflozin. So then you need to discuss it with your doctor that whether this is causing it or not. So if you're not on that, maybe optimum glycemic control is the answer. If you're on that, then that medication has to be modified.
Great. Thank you so much for your patience and elaborate answers. Our viewers are also thanking you on the chat platform. Thank you once again, Dr. Saptarshi. Before you take, we give you, we take leave from you. I would want you to give top tips to manage diabetes to sum up what all we have talked about today.
Okay. So I think it's a very diabetes is a disease which requires involvement from your side. So if somebody is having diabetes, you can't just depend on medicines. You need to institute changes which are part of your life. So you need to take medicines. Also, you need to follow your diet, and also you need to institute your lifestyle changes like exercise and having timely meals and everything else. So if and we get a very common query that if I'm okay, I have diabetes, my sugar is 250, but when you develop a complication related to diabetes, it's already too late. So you just need to prevent complications related to diabetes. And so don't wait for the day where you have a problem and you come to me or come to an endocrinologist with okay, I have this set of problems and give you a medicine and everything is going to get cured. That's not going to occur. So you need to make changes in your life right from today, where in terms of diet, in terms of lifestyle changes, in terms of medicine, and in terms of a regular follow up with a doctor, and hopefully it should not cause any major problems.
Great. Thank you so much. It was a pleasure talking to you. It was
Thank
a
you.
very, very enlightening session. Thank you, Dr. Saptarshi.
Thank you. Thank you.
Great. So, thank you all for your interesting questions because you made this session really very interesting. Now, I'm going to ask you 3 questions. We're going to talk, we're going to get into health quiz. Answer the questions on YouTube chat only. Winner's name will be announced towards the end of the show. And winners, you have to email once your name is announced on the show. Please send your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. चलिए आज का quiz शुरू करते हैं. The first question of today's health quiz is: imbalance of which hormone in the body causes diabetes? Imbalance of which hormone in the body causes diabetes? And question number 2, when is the World Diabetes Day celebrated? When is the World Diabetes Day celebrated? And question number 3, which option on Apollo 24/7 app allows you to book COVID vaccination slot? अभी boosters भी लग रहे हैं and then preventive dose भी लग रहा है, which is important. Go get yourself vaccinated. Question number 3 is, which option on Apollo 24/7 app that allows you to book COVID vaccination slots? So answer your questions on the YouTube chat. We're waiting for the winners. In the meanwhile, let me give you the coupons. The first coupon for today is First VC. Use the code First VC. You can get on a 150 rupees off on first online consultation with Apollo doctors, which is a very simple thing. इसके लिए आपको पहले Apollo 24/7 डाउनलोड करना पड़ेगा. उसके ऊपर use the code First VC and get an online consultation at 150 rupees off on online consultation. So this is it. And next is First 3. ये code use कीजिए and you will get 25% off on online medicine orders. Order medicines direct from Apollo. So that is Apollo 24/7 पे आप ये code use कर सकते हैं. First 3 up to 25% off on online medicine orders. And while I'm waiting for the winners to be announced, here are the coupon codes for all of you who have joined live today. Use the code HH247. Get up to 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. So this is this week's health hour, which was very important. The takeaway message is manage your food choices, manage your lifestyle choices, keep exercising and keep diabetes away. And also if you have diabetes, do manage your diabetes well. And next week, we're going to talk about an interesting session. We're going to talk about the risk factors for asthma. Tune in to Health Hour, that is 1st May 2022, 11 a.m. If you do not want to miss this session or any other session, I strongly urge you all to subscribe to Apollo 24/7's YouTube channel. There's a bell icon somewhere, and you can subscribe, and you will not miss a single session. Next week, we're going to talk about the risk factors for asthma. And I'm still waiting for our winners. नाम मैं उनके लिए wait कर रही हूँ. But thank you all, because your questions have made a lot of difference. Even if I'm not able to, if I could not take a question or two, they are covered in the answer that doctor has given. Yes, here's the winners list. Karthik, Praful and Debashish. Karthik, Praful and Debashish, congratulations. Please write back to us to claim your gift vouchers. Thank you all of you for joining us today on this live session. Thank you, Dr. Saptarshi. And next week we shall see you with another Apollo expert. Namaskar.